Acidity or gas. Let's look at what are the symptoms of acidity and gas. One of the major symptoms is burning. Now, this burning can be in your throat, it can be in your chest, or it can be in your stomach area. It's like the whole pipe is on fire. It's like you're breathing fire. This can happen after you have a meal, it can happen when you're on an empty stomach. It can happen sometime in the middle of the night where you have to get up and drink some water or something and then go back to sleep. The second major symptoms that you go through is gas formation. Now, this gas could be in the form of a burp upwards, or it could be a fart downwards, or the worst is the gas getting stuck in the stomach, neither coming up or going down. You are so uncomfortable, you are pacing up and down, you're rubbing your tummy, you're trying all kinds of things just to release the gas. Now, people also suffer from stomach pain, difficulty to swallow, sensation of a lump in the throat, bloating, I've already told you. There are people who burp continuously. Loud burps, smaller burps. I get patients who come and say that wherever you press on the body, they can burp. You press on the shoulder, they can burp. Press on the chest, they can burp. There are many people like that. Now, let's look at what causes acidity. One of the biggest cause the scientific community has ever told us is that if you don't eat your food on time, you will end up in acidity. So they always advised us to eat every 4 hourly. But then came the 16-hour fast, which won the Nobel Prize, and that says that you have to be on an empty stomach for 16 hours. It goes on to say that your body works best when your stomach is empty. So we are confused. We also know that acidity can be caused because of a lot of spicy food that we eat. It can also be caused because of a lot of allopathic medications like painkillers and other medicines which are used on a regular basis. One of the other major reasons for acidity is stress. Yes, stress does play a very, very important part in acidity because our life is full of emotions. So every time there is a fluctuation in our emotions, it controls the acid levels also. Then, of course, there is a genetic tendency. It runs in the family. You would have seen your father, mother, or uncle, or grandfather burp like you, or you would have seen them all the time complaining of something that is not right in the stomach. So, this can run in the family, and if unfortunately you inherit a bad stomach, you cannot completely repair it. You can make it much, much, much better. We've been able to help a lot of people that way. So now, having known the causes and the symptoms of acidity, let us look at what can we do. Unlike before, it is not that you just start off on some medications and then your acidity gets cured. It can happen in an acute acidity where you have acidity just for a day or two, you take some antacids, you feel better. Otherwise, you end up with the doctor and the doctor gives you an antacid, and in most cases, you are stuck with this antacid for months, years, or for the rest of your life. I've known many patients who were stuck with the acid tablets, antacids for close to 20 years, 25 years, or all their lives. And as they grow older, they have to take other medications for various other illnesses, and along with that, an antacid is also given. So the problem is, there has been many studies which has proven that taking antacids for years together can affect other organs of the body, including the kidneys. Now, previously, the concept was that you go to the doctor, take your medications, and you become alright. It still holds true for acute diseases like a fever or an infection. But for something that is chronic and something that you've been suffering for years together, it does not go away just by taking medication. There are things that you need to do. It has to be something that you do and the doctor does. So I'm going to show or tell you a few things that you are supposed to do along with taking medications. It is something both of us have to do together. It is a journey that you and I have to do together in order to help you with your acidity. There is no other way. So one of the first and foremost thing that I would say to take care is your diet. Now, what kind of diet? Now let's assume that 10 of us take milk or non-vegetarian. Do all the 10 of us react the same way? No. Each one of us will react differently to milk and non-vegetarian. So if each one of us react differently to food, how can there be a common diet for acidity? There cannot be a common diet. Then what to do? So one of the best way to know what is good for your body, what is not good for your body, is an age-old evaluation of your doshas, which is to know if your vata, pitta and kapha are in balance. This has been followed for thousands of years by the Ayurvedic science, and I have made a comprehensive video on this. You can click on that video, go through that questionnaire. The questions include both your physical and mental reactions, so that you determine what is your constitution, what is the best food for you and what is the worst food for you. So first determine this by doing this quiz, so that you're aware of what to eat, what not to eat. The second thing is the diet that you need to follow in terms of how to eat, how much to eat, what to eat. What to eat, of course, the dosha will tell you. The rest of it, I have made a comprehensive video on the diet. It is not a diet, it is a concept. It is important for you to understand the concept. I am not trying to push a diet which you can do it for a little while, stop it, again do it. No, I am giving you a concept. If you are aware of how to eat, you will maintain it for the rest of your life. So it is very important for you to go through this comprehensive video on diet and follow it as much as possible. It will make a tremendous change in your life and in your acidity. The third and the most important thing is balancing your 5 elements of nature. You see, we are made of 5 elements, and it is very, very important to balance these 5 elements. In search of comfort and conveniences, we have gone away from our source of creation, that is the earth, the water, the fire, air and space. There is an urgent need to connect back with our source of creation, and that can happen only by balancing the 5 elements. I made a detailed video about how to balance the 5 elements and how to take care of yourself. Now these are the 3 things that you need to do. The next and the most important thing is medication. What can homeopathy do? We at our clinic have helped close to 10,000 patients who have approached us for gas and acidity, and we've been able to help most of them. You see, what you need to understand is acidity is only an effect. What you experience, acidity and gas, is only an effect of something that is happening within your body. So the causes are multiple. If you are only treating the effect, which is the case with the antacid will take care of the effect, that is the acidity. So as long as the effect is taken care of, you feel better. But the moment you stop the medications, you're back to square one again. So there is a need to treat both the cause and the effect, and this is done in homeopathy. So we've treated close to 10,000 patients and we've been able to help most of them. Homeopathy takes into consideration a lot of cause symptoms like acidity from fatty food, acidity from sweets, acidity from stress, acidity from overthinking, acidity from lack of physical exercise, acidity from a tendency, acidity from a genetic tendency. A whole lot of things are considered in homeopathy. That means we take into consideration both the cause and the effect, and when the cause and effect are treated, the treatment is more permanent. Those of you who are already on antacids for many years, you continue both with the allopathy and the homeopathy together for some time. Once you begin to feel better, slowly taper the acidity medications. Make it alternate days, once in 2 days, once in 2 days, 3-4 days. Then make it only when needed, and eventually you don't have to use antacids anymore. Your system itself will regulate the acid in your body. Of course, from time to time it might come up depending upon triggering factors like overeating or too much of stress or taking some allopathic medications. It might trigger it out, but that can be managed very easily. If you suffer from acidity, which is burning and gas formation, take whatever you are taking, which is giving you relief, but treat the cause and the effect with homeopathy, which will be of tremendous help to you. Take care.